We are exploring 10 mind molders. In this episode, we are going to see H, which stands for health services. We know that Lord Jesus Christ's ministry included healing of people. The lepers were cleansed, blind received the sight, the paralyzed were able to walk, and Peter's mother-in-law, who was having fever, got relief. And even in Old Testament, we see about healing. Lord sent His word and healed the people. So healing is part of the ministry. So when we look at the society today, the city today, health services becomes very, very important. When you look at the global scenario, the missionaries, especially the doctors and nurses who travel from the West into various parts of the world, started mission hospitals. So that changed the whole nations. So when we see at India, there were more than 500 mission hospitals in the year 1947, started by missionaries so that they can do health mission. So today, when we look at health sector today, that has been changed. The health sector, which was a service, now has become a business. So now money becomes the motivation rather than the compassion, the mercy and love of Lord Jesus Christ. So the health sector, which was dominated by Christians, which was moved by compassion and love, has been replaced by health services, which is having a commercial model or which has profit as a motive, which commercialized the service into a business. So that has brought a lot of ill effects in our nation. So the healthcare, which is privatized, we have many private hospitals today, and also we have private insurance companies. Many times they combine together and they have not helped the people, but they have looted the people. So this has happened because the church had left the influence, the place of influence, and retreated into a ghetto mentality. Instead of going out and instead of multiplying, they remained as one. So instead of starting medical colleges in every state, instead of starting medical hospitals in every city, so we did not do that. Instead, we were closing the hospitals. The reason was infight. The reason was lack of vision. So today, we have another opportunity to be involved in healthcare. So not only healthcare, there is an issue of hygiene. So civic hygiene. So we are talking about Swachh Bharat. That means where hygiene becomes a priority. So it is not about cleaning the city, it is not dirtying the city. So that is a proactive reaction that has to be done. But instead, we are thinking about cleaning the city. So how can we keep the city clean without dirtying it? So that is where the church has to play a role. We have to teach about civil hygiene. Our schools, our Sunday schools, our youth, youngsters should be taught about personal hygiene and as well as civic hygiene. So unless we do that, we cannot achieve civic hygiene or the civil hygiene. And also we have to think about the community health. So that is also lacking. So we have to work on the community health. How as a community we can work on the health issues. So we are more individualistic and our families are alienated from others. So there is no communal solutions, community solutions for the health issues. Above all, we need the preventive health to be done. So that is also lacking. So the church can become pioneers in teaching preventive health to the society. In many villages, the churches have a great role. For example, most of the women who are pregnant do lack iron content. So the simple solution is providing them the iron tablets. So the churches in villages can partner with public health centers and provide iron tablets every day for the women in the village or in their locality and be a service agency. So by taking these pioneering efforts, taking these innovative efforts, taking these creative efforts, we can build inroad in the community. We can build relationship in the community. Unfortunately, so the church is not involved in the preventive health. So we have to think innovatively. How can we regain the preeminent position we had in health mission? So health professionals have to come together. Maybe there's a need for multi-speciality hospitals in cities. How can Christian health professionals come together and start such group of hospitals in cities which could be multi-speciality hospitals? So when we think health as a mission, the church had played a role, church has experience, and church has motivation, and as demonstrated by Lord Jesus Christ, healing through the mission work or hospital work can be done by the church. The church has to think innovatively, creatively to infiltrate or to penetrate the health system and bring transformation in the society as well as in the country. May God bless you.